Hello and welcome to the Emergency Room Podcast, the place where we delve into the fast-paced, life-saving world of emergency medicine. Are you ready to explore the critical decisions and cutting-edge treatments that happen daily in the ER?
Okay, so today we're going to do a deep dive into the ER management of severe asthma attacks.
Oh, yeah.
And, when someone comes in really struggling to breathe,
Right.
it can be one of the most intense situations in medicine.
Definitely a lot of pressure.
Yeah, every second counts.
Absolutely.
So maybe before we get into the specifics of, what you do in the ER,
Okay.
you could give us just a quick reminder of what exactly asthma is.
Sure. So asthma is a chronic disease that affects the airways in your lungs.
Okay.
And the airways are kind of like pathways for air to move in and out. And in asthma, those airways become inflamed and swollen.
Okay.
So it makes it harder for air to pass through.
So that's what causes the difficulty breathing.
Exactly.
I got it.
Yeah, when those airways are narrowed, it's almost like trying to breathe through a straw.
Right.
It just takes so much more effort to get air in and out.
Okay, now I know that when someone comes in having a really bad asthma attack,
Yeah.
doctors talk about something called respiratory failure.
Right.
Can you explain what that is?
So respiratory failure is basically when your lungs can't get enough oxygen into your body or remove enough carbon dioxide.
Okay.
So think of it like an engine that's just not working properly.
Okay.
And we classify respiratory failure into different grades.
Okay, so like different levels of severity.
Exactly, yeah, like a scale almost.
Okay.
So grade 1 is pretty mild. The patient might be breathing a little faster than normal, maybe showing some signs of struggle, but they're still alert and talking. As it moves into grade 2, the breathing gets much more labored and they might start to have some changes in their mental state because the oxygen levels are getting low.
Oh, wow.
And then grade 3 is the most severe form.
Okay.
At that point, the patient's often exhausted, they're barely able to breathe, and they may even become unconscious.
Wow.
So yeah, it's a life-threatening situation that requires really quick intervention.
So then what are those interventions like? Yeah. When someone comes into the ER with a severe asthma attack, what are the first steps?
So the absolute top priority is to stabilize their breathing. And we do that as quickly as possible.
Okay.
We focus on 3 main goals:
Okay.
relieving the obstruction in the airways, reducing inflammation,
Okay.
and providing breathing support if needed.
So it's a 3-pronged approach.
Yeah.
Gotcha. Okay, so what are some of the medications that are used? I know there are different types like SORBAs and SOMAs.
Right, yeah. So short-acting beta agonists, or SORBAs, are the first line of treatment.
Okay.
They work by relaxing the muscles around the airways, which allows them to open up.
Got it.
Albuterol is a common SORBA that we use.
Okay.
And we usually give that through a nebulizer in doses of 2.5 to 5 milligrams.
Okay, and what about SOMAs?
So SOMAs, or short-acting muscarinic antagonists, work a little differently.
Okay.
They block a certain receptor that causes the airways to constrict.
Okay.
Ipratropium bromide is a common SOMA.
Okay.
We typically give that at a dose of 0.5 milligrams, also through a nebulizer.
Okay, so they both help to open up the airways, but through different mechanisms.
Exactly.
Okay, and then what about the inflammation?
Yeah.
That's also a big part of asthma.
Absolutely.
So I imagine that needs to be addressed as well.
Definitely reducing inflammation is crucial for managing these severe attacks.
Okay.
And we use glucocorticoids for that.
Okay.
They're really potent anti-inflammatory medications. They basically work by suppressing the immune response that's causing all the swelling in the airways.
So they're kind of like the heavy hitters
Yeah, you could say that.
in the fight against inflammation.
Exactly.
Okay.
So prednisone is a common one. We use that a lot.
Okay.
And that can be given orally or intravenously, depending on how severe the attack is.
Gotcha. And in the ER setting, you're often using intravenous magnesium sulfate as well.
Yeah, that's right.
So can you talk a little bit about that?
Intravenous magnesium sulfate is a really powerful bronchodilator.
Okay.
So it helps to relax and open up the airways even more. And it also has some anti-inflammatory properties as well.
Yeah.
Yeah, it's a good one. We often use it in severe cases where other bronchodilators haven't been working.
Okay. Now, our listeners always like to know the specifics. So can you tell us about the dosage and how it's administered?
So the standard dose for intravenous magnesium sulfate is 2 grams.
Okay.
And we dilute that in a solution and give it over about 20 minutes through an IV line.
Okay. And then you mentioned breathing support. earlier. So what does that involve?
So sometimes patients with severe asthma attacks need a little extra help to breathe.
Okay.
And we can provide that through non-invasive ventilation, or NIV.
Okay.
That's a way to support breathing without having to do intubation.
Okay.
It basically involves using a mask that fits snugly over the nose and mouth, and that delivers pressurized air, which helps to open up the airways and improve oxygen levels.
So it's like giving the lungs an extra boost.
Exactly.
Okay, so a specific type of NIV that's often used for asthma is VMNI, right?
Yep.
Non-invasive mechanical ventilation.
Yeah, and it can be really effective in those more severe cases.
But I imagine there are times when you have to go further and
Right.
do intubation.
Yeah.
So when does that happen?
So intubation, which involves putting a breathing tube into the trachea, is reserved for the most severe cases where non-invasive methods aren't enough.
Okay.
We monitor the patient very closely and how they respond to the NIV and the medication. And if they continue to get worse despite everything we're doing, then intubation might be necessary.
And what about auto PEEP? I know that can be a big problem in these attacks.
Yeah, for sure.
What exactly is it?
So auto PEEP, which is also called intrinsic PEEP,
Okay.
happens when air gets trapped in the lungs during exhalation.
Oh.
So it makes it harder for them to breathe out completely.
Oh, wow. Okay, so it's like you said before, like trying to breathe through a straw,
Kinda, yeah.
but even harder.
Right. It's like trying to blow up a balloon that already has some air in it.
Gotcha.
You have to work a lot harder.
Oh.
So yeah, auto PEEP just increases the work of breathing and puts a lot of strain on the lungs. It can definitely lead to complications.
So how do you deal with that then?
There are several things we can do.
Okay.
One approach is to adjust the settings on the ventilator if the patient's on one, so we can give them more time to exhale.
Okay.
We can also use some manual techniques,
Okay.
like applying gentle pressure to the chest during exhalation to help them empty their lungs better.
So it sounds like it's kind of a delicate balancing act.
Yeah, it definitely requires a lot of monitoring and adjustment. We might need to give them more medication to help open up the airways and reduce that air trapping.
Okay.
It's a very dynamic process. We
Right.
have to constantly evaluate and fine-tune our approach.
Wow. It's fascinating to hear how you navigate these really complex situations in the ER.
Yeah, it's definitely challenging.
Yeah, a lot going on all at once.
For sure.
So it makes me think about all the advancements in technology and how they're impacting emergency care.
Right.
So are there any exciting new developments on the horizon that you think could change how we approach these severe asthma attacks?
Yeah, there's some really cool research going on.
Okay.
One that I'm particularly excited about is the potential of AI.
Wow, AI in the ER, that sounds very futuristic.
It kind of is, but it's closer than you think.
Oh, wow.
Researchers are developing systems that can monitor a patient's breathing oxygen levels and all sorts of other vital signs.
Okay.
And the AI can use that information to adjust the ventilator settings in real time.
Wow. So it's like having a personalized ventilator.
Exactly.
Okay.
So instead of relying on these fixed settings, the ventilator can adapt to the patient's changing needs.
Wow, that's incredible.
Yeah, it's pretty amazing.
Yeah.
It's almost like having a really skilled respiratory therapist,
Right.
constantly fine-tuning the ventilator based on the most up-to-date information.
That's incredible. So what other areas of emergency asthma care do you think AI could help with?
Well, AI could also be really valuable in predicting which patients are more likely to develop complications or need intubation. Oh, wow. So like a risk assessment tool.
Exactly. By analyzing huge amounts of data, AI algorithms could identify patterns and risk factors
Right.
that we might not be able to see as clinicians.
So it's like having this extra set of eyes that can sift through all this information
Yeah, that's a great way to put it.
and spot trends.
Yeah, the potential for AI to improve how quickly and accurately we diagnose and treat these patients is huge.
That's really exciting. But are there any concerns or challenges with bringing AI into the ER?
Oh, for sure. Like with any new technology, there are things to consider.
Yeah.
One big one is data privacy.
Okay.
You know, we need to make sure that all the patient data is being handled responsibly and ethically.
Right. People need to feel confident that their information is protected.
Absolutely. And another challenge is making sure that these AI systems are really well tested and validated before we start using them with real patients.
Yeah. Makes sense.
We need to be certain that they're going to make the right decisions.
Right. So it's not just about developing the technology.
It's about implementing it carefully and responsibly.
Exactly. It's a team effort with clinicians, researchers, engineers, ethicists, and policymakers all working together.
Wow. So it's a really big undertaking.
It is, but the potential benefits are really exciting.
Yeah, sounds like it.
Yeah, I think the future of emergency asthma care is looking pretty bright thanks to these advances in AI.
That's great to hear.
Yeah.
So this deep dive has already been so eye-opening.
Good.
It's amazing to see all the progress that's been made in managing these severe asthma attacks.
Yeah.
And it's even more incredible to think about all the possibilities that are still ahead.
I agree. It's a really dynamic and evolving field, and I'm really optimistic about what the future holds.
Me too. So for our listeners out there who are living with asthma or know someone who is, what are some of the key takeaways from our discussion so far?
I think one of the most important things to remember is that early recognition and quick action are crucial.
Okay.
If you're having an attack and your usual reliever medication isn't working, you need to get medical help right away.
And it's important to understand your triggers
Oh, definitely.
and how to manage them.
Yeah, knowing what sets off your asthma and taking steps to avoid those triggers can really help.
Right. So it's all about being proactive
Exactly.
and empowered in your own health.
Right. Knowledge is power. And the more you know about your asthma, the better you'll be able to manage it.
That's a great message.
And it's also reassuring to know that all these healthcare professionals are constantly working to improve treatments and develop new approaches.
Absolutely. Yeah. The research and innovation are really impressive.
Yeah, there's a real dedication to finding better ways to help people live full and active lives, even with asthma.
Yeah, it's a message of hope and progress.
Definitely.
So you mentioned earlier that there are some good resources available
Right.
for people who want to learn more about asthma.
Yeah, so the Global Initiative for Asthma, or GINA, is an excellent resource.
Yeah.
They have these comprehensive guidelines for asthma management that are based on the latest scientific evidence, and they update them regularly, so you always have the most current information.
Gotcha. So it's like the gold standard for asthma information.
Yeah, pretty much. And the best part is that their report is free.
Wow, that's great.
Yeah, you can access it right on their website.
Okay, so there's really no excuse not to stay informed.
Exactly. It's all right there at your fingertips.
That's fantastic. Well, this deep dive has given us so much to think about.
Yes.
From the intricacies of emergency care to the potential of AI and the promise of personalized medicine.
It's been a great discussion.
It really has. But
Yeah.
before we wrap things up, I'd love to hear your thoughts on the future of emergency asthma care.
Okay.
What are you most excited about?
You know what really excites me is the potential for personalized medicine.
Yeah.
As we learn more about what causes asthma and how it varies from person to person, we're getting closer to an era of truly tailored treatments.
So instead of one size fits all, it's more about finding what works best for each individual.
Exactly. Imagine a future where we can pinpoint the exact molecular pathways that are involved in a person's asthma and then target those pathways with very specific therapies.
That sounds amazing.
It is. It's kind of like science fiction coming to life.
Yeah, it does.
We're already starting to see this with biologic therapies that can target very specific molecules that are involved in inflammation.
Okay.
And with all the advancements in genomics and personalized medicine, we're really just scratching the surface of what's possible.
That's incredible. It's a future full of possibilities.
Absolutely.
And it gives so much hope to millions of people living with asthma.
I agree.
So this has been an amazing deep dive.
It has.
We've covered so much.
Yeah.
From the urgency of the ER,
Yeah.
the cutting edge of AI, and this incredible promise of personalized medicine.
It's been a pleasure sharing my thoughts with you and your listener.
Well, thank you so much for being here today.
You're welcome.
And for our listeners who are eager to learn more, be sure to check out the resources that we mentioned, including the GINA website. And of course, the best way to stay informed is to subscribe to the deep dive.
For sure.
We'll be back next time with another fascinating exploration of the world of health and science. Until then, stay curious, stay engaged, and keep those questions coming.
Sounds good. Yeah, it can be really tricky sometimes.
Right. So what are some of the ways that you try to reduce auto-peep?
Well, we can try a few different maneuvers.
Okay.
Sometimes we adjust the settings on the ventilator if the patient's on one.
Okay.
That can give them a little more time to exhale.
Okay.
We can also use some manual techniques, like putting a little bit of pressure on their chest when they breathe out.
Oh, okay. So to help them empty their lungs more effectively.
Exact.
Wow. So you really are dealing with a lot of different factors
Oh, yeah,
all at the same time.
definitely.
So it makes me think about how technology is changing things in the ER.
Right.
Are there any new developments you're excited about that could change how we approach severe asthma attacks?
There are some really cool things being researched right now.
Like what if,
One I'm particularly interested in is the potential of artificial intelligence.
oh, wow. AI in the ER, that sounds like something out of a movie.
I know, right?
But seriously, AI, how could that help?
Well, researchers are developing these AI systems that can continuously monitor patients, their breathing, their oxygen levels, all sorts of vital signs.
Okay.
And then use that data to adjust the ventilator settings in real time.
Wow. So it's like a super smart ventilator.
Exactly.
That can adapt to the patient's needs.
Right. It's like having an expert respiratory therapist constantly fine-tuning the ventilator.
That's pretty amazing. Are there other ways AI could be helpful with these severe asthma attacks?
I think so.
Okay.
One area is predicting which patients might be at higher risk for complications.
Okay.
Or might end up needing intubation.
So like a risk assessment tool.
Exactly.
Got it.
These AI algorithms can analyze huge amounts of patient data.
Right.
And pick up on patterns that we as humans might miss.
That's pretty cool.
Yeah, it's like having an extra set of eyes. But eyes that can see through mountains of data.
Right, and spot these subtle trends.
Exactly. The potential for AI to help us make faster and more accurate decisions is huge.
Okay, but I have to ask.
Sure.
Are there any concerns or challenges that come along with using AI in the ER?
Oh, of course. Like with any new technology, we have to be careful.
Yeah.
Data privacy is a big one.
Okay.
We have to make absolutely sure that all patient data is being handled responsibly and ethically.
Right. People need to know that their information is safe and secure.
Absolutely. And we also need to make sure that these AI systems are thoroughly tested before we use them with real patients.
Yeah, of course.
We need to be confident that they're making the right decisions.
So it's a big responsibility
Yeah,
to implement this technology safely and effectively.
Definitely. It takes a lot of collaboration between clinicians, researchers, engineers, ethicists, policymakers.
Wow, so it's a big team effort.
Yeah, it really is.
But it sounds like the potential benefits are worth it.
I think so. The future of emergency asthma care is looking pretty bright thanks to these advances in AI.
Well, that's good to hear.
Yeah.
This deep dive has been so eye-opening.
Oh, good.
It's amazing to see how far we've come in managing these severe asthma attacks.
Yeah, a lot of progress has been made.
And it's even more exciting to think about where we might go from here.
I agree. It's a really dynamic field,
Yeah.
and I'm optimistic about the future.
So for our listeners out there who are living with asthma or who know someone with asthma,
Right.
what are some of the key takeaways from our conversation?
I think the most important message is that early recognition is key.
Okay.
And so is taking action quickly.
Right.
If you're having an attack and your usual inhaler isn't helping, you need to get medical attention right away.
Don't wait.
Exactly. Don't hesitate.
Okay. And it's also important to really understand your asthma triggers,
Absolutely.
how to manage them.
Knowing what sets off your asthma and taking steps to avoid those things can really help you prevent severe attacks.
So it's all about being proactive
Exactly.
and taking control of your health.
Right. Knowledge is power, and the more you know about your asthma, the better you'll be able to manage it.
Absolutely. And it's good to know that all these healthcare professionals are out there working hard to improve treatments and develop new approaches.
Oh, definitely. The research and innovation in this field are incredible.
Yeah, it's impressive.
Yeah.
There's a real dedication to helping people live full and active lives,
Yeah,
even with asthma.
definitely.
So you mentioned some good resources for people who want to learn more about asthma.
Right.
Can you remind us what those are?
Sure. So the Global Initiative for Asthma, or GINA, is an excellent resource.
Okay.
They publish these really comprehensive guidelines for managing asthma,
Okay.
and they're based on the latest scientific evidence.
Got it.
They update them regularly, so you always have the most up-to-date information.
So it's like the go-to source for reliable asthma information.
Yeah, pretty much. And the best part is that their report is free.
Wow. That's great.
You just download it right from their website.
Fantastic. So there are really no excuses for not staying informed.
I know, right? It's all right there at your fingertips.
Well, this deep dive has given us so much to think about.
Yeah, for sure.
The intricacies of emergency care, the potential of AI, this whole idea of personalized medicine.
It's been a great discussion.
They really have. Before we wrap up, though, I'd love to hear your thoughts on the future of emergency asthma care.
Okay.
What are you most excited about?
You know, I'm really excited about the potential of personalized medicine.
Yeah, me too.
As we learn more about asthma and how it affects people differently, we're getting closer to a future where treatments are tailored to each individual.
So not just a one-size-fits-all approach anymore.
Right. Imagine a future where we can identify the exact molecular pathways involved in a person's asthma
Okay.
and then target those pathways with very specific therapies.
That sounds amazing.
It is. It's almost like science fiction becoming reality.
Yeah, it does.
We're already starting to see this with some of the new biologic therapies that can target specific molecules involved in the inflammatory process.
So it's a more targeted approach?
Exactly. And with all the advancements in genomics and personalized medicine, we're really just at the beginning.
Wow. It's exciting to think about all the possibilities.
It is. It's a future filled with hope for millions of people living with asthma.
It really is.
Yeah.
So this has been a truly incredible deep dive.
It has.
We've covered so much.
Yeah.
From the urgency of the ER to the cutting edge of AI and this incredible promise of personalized medicine.
It's been a pleasure sharing my insights with you and your listeners.
Well, thank you so much for being here with us today.
It is my pleasure.
And to our listeners out there, if you want to learn more about asthma, be sure to check out the resources we mentioned.
Right.
The GNA website.
Definitely.
And, of course, the best way to stay up to date on all things health and science is to subscribe to The Deep Dive.
For sure.
We'll be back next time with another fascinating topic. Until then, stay curious.
It's been a really fascinating conversation.
It has, and I know our listeners appreciate these deep dives.
Yeah.
You know, we try to give them the information they need to really understand these complex health topics.
Absolutely.
So, you know, we've been talking about all these advances in asthma care,
Right.
and you mentioned personalized medicine earlier. I'm really curious to hear more about that.
Okay.
What are some of the specific areas of research that you're most excited about?
Well, there's so much going on right now, it's hard to choose.
Yeah.
But one area that I find particularly fascinating is the research on the microbiome.
Oh, the microbiome.
Yeah.
So that's like all the bacteria and other microorganisms that live in our bodies.
Exactly. And we're learning that it plays a really important role in our immune system and how it develops and functions.
So is there a connection between the microbiome and asthma?
Well, there's growing evidence that imbalances in the gut microbiome might be linked to the development of asthma.
Interesting.
Especially in early childhood.
So could we actually manipulate the microbiome to help prevent or treat asthma?
That's the million-dollar question.
Yeah.
Researchers are looking into things like probiotics and prebiotics.
Okay.
Even fecal microbiota transplantation.
Wow.
To see if we can change the gut microbiome and maybe influence the course of asthma.
That's amazing.
Yeah.
It seems like we're just scratching the surface.
Yeah, we are. There's so much more to learn.
What about those new biologic therapies you talked about?
Oh, yeah, those are really promising.
Can you explain how those work?
Sure. So they're basically engineered antibodies that block specific molecules that are involved in the inflammation that causes asthma symptoms.
This is a more targeted approach.
Exactly. Instead of just suppressing the whole immune system like traditional corticosteroids.
Which can have a lot of side effects.
Yeah. Exactly.
So these biologics can target the specific pathways that are causing the problems.
That's the idea.
Wow. It sounds like we're on the verge of a whole new era in asthma care.
I think so. We're moving away from that one-size-fits-all model and towards personalized treatments that are tailored to each individual's needs.
It's really exciting to think about all the possibilities.
It is. We've come a long way.
We have, and there's still so much more to discover.
Definitely.
Well, this has been an incredible deep dive into the world of emergency asthma care.
I agree.
We've covered everything from the basics of breathing to the latest advances in treatment and this amazing potential of personalized medicine.
It's been a great conversation.
It really has. Thank you so much for sharing your expertise with us today.
It was my pleasure.
And to all our listeners out there, we hope you found this episode informative and empowering. Remember, knowledge is power when it comes to your health. And if you want to learn more, be sure to check out the GNA website.
Great resource.
It is. And of course, the best way to stay up to date on all the latest in health and science is to subscribe to The Deep Dive.
Thanks so much for joining us today on the Emergency Room podcast. Please smash that like button. It helps us reach more colleagues and keep the educational content coming. Don't forget to share this video with your fellow healthcare professionals. And if you're not already part of our community, please subscribe to the channel and hit the bell notification so you never miss out on our next cutting-edge discussion. We're dedicated to providing the most up-to-date, evidence-based information to keep you at the forefront of emergency medicine and critical care.